We had that sense that we could have a genuine human impact.
The intensity was absolutely incredible.
Seeing those images, seeing the news reports, to say it was daunting is an understatement.
Here we were in the middle of March. The COVID infection rate was doubling every 4 days in the UK, and that infection rate was itself increasing. And it was on the 14th of March that the Prime Minister made a call to industry, and immediately after that, PA was called by the Cabinet Office.
The government set a goal of producing 30,000 ventilators in just 8 weeks. This was unprecedented.
We have to increase production by 100 times. That basically means everything around the production has to be scaled up to that extent, which means the number of people working on this, the resources, the facilities.
We needed to look at new designs. Whenever you make a change to a medical device, you've got to get it reapproved. We needed to get access to hospitals to do the trials. We needed manufacturing capability on the scale of automotive manufacturing, not on the scale of medical device manufacturing.
Within 48 hours, I was chairing the Technical Design Authority, where I had somewhere between 40 and 50 leading experts presenting their ideas on ventilators.
Our ability to bring across the full might of the Department for Health, the Cabinet Office, MHRA, private sector, and obviously the skills across PA was really important to mobilise incredibly quickly.
What really worked well for us was having the PA team really as an extension of our own workforce.
We set up round-the-clock modelling to make sure that we could get a very quick handle on what demand would look like.
We had limited time for thinking. We literally had to do thinking and doing in parallel.
We stood up 15 design programs within about 3 weeks. And each one of those had a set of partner organisations around it. In total, there were probably about 50 different companies, from the largest of the UK manufacturing companies all the way through to very specialist manufacturers.
I like to frame PA's role in Ventilator Challenge as being an intelligent integrator. We were responsible for taking inputs from a number of important stakeholders from the Cabinet Office, Department for Health, MHRA, and the private sector.
We were having to work at lightning speed on every single front, from design all the way through to delivery.
We had all of these really complicated work streams and they were all moving at different paces. And we had to tie that all together to make sure the package was delivered how it should be.
One of the established ventilators was in need of a new type of trolley. Through our triage process, we linked them up to the McLaren design team, who then very quickly designed a new trolley that would be able to help this ventilator be transportable within hospital.
We had 15 designs in total. We were able to take forward 4 of those.
We moved parts from 21 countries across 5 continents over to the UK and Sweden, where the ventilators were being manufactured.
I won't forget having to call up and get a factory taken out of mothball because it was the only way to get components into production faster.
We use the MOD and some of their facilities to actually store, manage and fulfill the shipments and requirements of the ventilators going out to the various hospitals and trusts.
We've developed over 100 training documents that cover over 50 ventilators in total.
One of the greatest achievements, I think, is the fact that we've left the Department for Health with a large stock of ventilators ready to use should they need them.
Any startup that has grown at that speed, there'll be things that one would look at and say, gosh, I wish we could have done that a little bit better. But given any reasonable sense of perspective, what PA managed to achieve for us was astonishing.
PA's purpose is to create a more positive human future. I don't think any project has demonstrated that more than this one.
PA's work on the Ventilator Challenge was monumental and mind-blowing.
I think the proudest moment was when we started to see ventilators come off the supply chain and actually start going into hospitals, going into where they needed to be.
ultimately it's been a massive success, so I'm very proud to have been part of this project.
Ingenuity is at the heart of everything that PA does, and we knew from the very beginning of this program that ingenuity, thinking differently, was going to be fundamental to our success.
The sheer amount of hard work, expertise across a breadth of skills, and the ability to adapt and develop and change, I really don't think anybody else could come near PA on this project.
It was incredibly scary. It was exhilarating. I felt a massive sense of responsibility, and it'll be one of those moments which I will never forget for the rest of my life.